brought to you by Stress Alleviation and Management Incorporated. So, you've been accepted to GW. You're about to start the greatest 4 years of your life, but it's not all smooth sailing. You'll be exposed to new challenges, new people, and new struggles. Stress is inevitable. To deal with stress, you need to know exactly what it is. Stress, simply defined, is a physical, mental, or emotional factor that causes bodily or mental tension. In a college setting, stress can come from many sources, including a low GPA and social anxiety. When stress is present, the amygdala activates the hypothalamic pituitary adrenal axis. This is when the hypothalamus, pituitary, and adrenal glands respond to the stress by releasing a hormone called cortisol. According to Dr. Sonia Lupian's longitudinal study published in 1998, when there is continuous stress and too much cortisol, the hippocampus deteriorates, which causes the rest of the brain to deteriorate. Stress can therefore lead to serious medical problems, including depression. However, college students can more effectively reduce the stress brought about by a low GPA and social anxiety by using problem-focused coping mechanisms as opposed to avoidance coping. There are two primary methods to cope with this stress: avoidance-focused coping and problem-focused coping. Avoidance coping attempts to alleviate the symptoms rather than the root problem behind the stress. Mechanisms can be positive and can include meditation and prayer, but they can also be negative and can include alcohol and drugs. Problem-focused coping attempts to alleviate stress by dealing with the root of the problem. Methods of problem-focused coping can include proper time management and problem-solving strategies. Getting straight A's is hard work and stressful, but there are various ways to cope with the stress caused by lower grades. An example of a problem-focused coping mechanism is time management. To improve your GPA and reduce stress, it's best to manage time by creating a schedule that includes when to do homework, when to study for exams, and when to rest. An example of an avoidance coping mechanism that does not help stressed college students is procrastination. Procrastination does not aid in relieving stress because it causes you to avoid the root of your stress rather than helping you deal with the stress directly. An empirical study performed by Miri Cohen at the University of Haifa concluded that individuals who utilized problem-focused coping strategies had reduced anxiety before taking a test and also had higher overall scores than individuals who utilized avoidance coping strategies. According to a research study conducted by Barry R. Schlenker and Mark R. Leary, social anxiety refers to an individual's fear of being rejected by other people, as well as the individual's doubt in their abilities to interact well with others. A study conducted by Dr. Daniela Schiller and her colleagues showed that rats become frozen in their tracks and only move in fear after being exposed to a mild shock. The rats continued to respond consistently whenever inside the environment of where the shock was produced. Humans react similarly in social situations. Rejection and being judged negatively are our versions of mild shocks. We fear the situations of meeting new people after experiencing past rejection and negative judgment. Using avoidance coping by abstaining from social interactions prevents college students from dealing with their anxiety directly and prevents personal growth. However, once the scientists trained the rat to move in order to stop the shocking, the rat quickly learned how to stop the shocks. Similarly, people will continue to face social anxiety until they confront the issue. This can include trying to meet new people and talk to fellow students. A quasi-experimental study performed by Christina A. Brook at Brock University concluded that avoidance coping strategies like alcohol consumption are ineffective at reducing social anxiety. The 2-year-long study utilized a control group that did not consume alcohol as well as a group that consumed alcohol. At the end of the study, the anxiety scores for both groups remained the same, suggesting that alcohol did not effectively reduce social anxiety. Here's some key take-home concepts for you to remember. Problem-focused coping eliminates the stress. Avoidance coping alleviates the symptoms of the stress. College students can more effectively reduce the stress brought about by a low GPA and social anxiety using problem-focused coping mechanisms as opposed to avoidance coping mechanisms. Thanks for watching and enjoy your first year at GW.